You're watching The Update. Responding to severe cholera outbreaks in Zambia, the Universal Federation of Red Cross and Red Crescent Society has launched an emergency appeal. Now, this is aimed to support Zambia Red Cross Society in its auxiliary role for Zambia's Ministry of Health, also to mitigate the impact of the outbreak on affected communities and to prevent further spread of cholera. Giving this a background, in October 2023, a new cholera outbreak was reported and has seen an increase in transmission since mid-December, putting over 10 million people at risk. The outbreak initially emerged from the peri-urban areas of Lusaka province, right here in Lusaka, where most of the cases were being reported. Now, due to the high rate of transmission, the disease is now affecting people across multiple geographical areas. 9 out of 10 provinces have reported cases of cholera, with 6 provinces confirming cholera outbreaks. So we have the Red Cross Society in studio to help us discuss how they're going to come through and help government and other entities who are making sure that cholera mitigation measures are put in place. Stephen Poso is the Health and Care Officer. Good morning.
Good morning, Judy.
How are you?
I'm okay, and Happy New Year.
Happy New Year to you too.
Great.
Must be a busy period for you, isn't it?
Indeed, it is a busy period for us as a country, I think.
You know,
our partners.
Yeah, very true.
Yeah.
Every time I read something like this or I hear it, it's not even becoming a cliche, it's always just hitting home and saying, wow, this is very, very serious.
Yeah.
So for you, your take on the outbreak?
Yeah, indeed, it's in the public domain that we have cholera in our country. And as Red Cross, the number of activities that we are doing with regards to the outbreak. But just to emphasize that this is a public health threat, and it takes the efforts of every Zambian, and especially those in the affected areas like Lusaka. So I would say we are the manufacturing industry for the cases of cholera currently in the country as Lusaka.
And you being based here in Lusaka, I'm sure with other Red Cross bureaus across the country, there's interventions. But what are you then coming in with to make sure that you're helping other entities such as the government, the Ministry of Health, and also other entities that are concerned with this?
Yeah, so just also to give to respond to that, maybe I'll pick it from a little bit of the background about the Red Cross. So Red Cross is a humanitarian organization which is formed through the Act of Parliament, like Zambia Red Cross. We are in existence because of the Act of Parliament, guided by the Cap 303 of the laws of Zambia. And our focus as a humanitarian organization is to augment to government efforts and also align ourselves as partners in responding to human crisis. So in this outbreak, Red Cross has lined up a number of interventions, particularly to contribute and support the Ministry of Health as we respond to this outbreak of cholera in Lusaka. So to allude in terms of the appeal, this is one of the resource mobilization efforts that Red Cross is bringing on the table, and it has different segments and pillars that will be able to address. And also just to mention that already we are on the ground. I think when we received the notification of the first case in October, we already started responding through supporting different structures of the Ministry of Health. So indeed, there are a number of activities that are lined up and already happening in the community.
Every time we're talking about cholera, people start talking about it's an annual thing.
Yeah.
Whenever the rain comes, it comes with this. When you have your rounds or your interactions that you've had so far, since you heard the first case in October, as you said, what emphasis could you give for the people out there, for our viewers out there, in terms of the greatness of the cholera having this year?
Yeah, so you realize that cholera is what we call a fecal-oral route disease, which means that it's a connection to human fecal waste. And for whatever reasons, this waste finds itself in the mouth of the person, and finally within the system of the body. So when we go to the community, we emphasize this point, that indeed cholera being a fecal oral disease which presents itself in acute watery diarrhea, and it can kill a person within 3 hours if there's no point of care in the process. So our role as Red Cross is really to raise the awareness that people should understand that when they get cholera, there is a solution, but if they delay, they might lose their life. And so we are giving out health education through different platforms, and the most important platform that we are using is the volunteers. So we have volunteers within our peri-urban areas, those that have been trained and given the right information. And so their role is to give these correct messages to the communities through a mix of approaches. And one of the approaches we are using is the door-to-door. So we knock on the door, engage with the household members to talk about...
Are they giving you the time of day?
Yeah, they do.
Okay.
Yeah, they do give us the time, but in some cases we may find the senior members of the household are not there, but it's to engage with whoever is available, just to intensify in terms of information dissemination.
Deliberately gone to the hotspot areas, or you've just blanketed it to say you're going to talk to everybody out there?
Yeah, so knowing that cholera is spreading, like you rightly put it, that over 9 provinces have reported a case of cholera, and over 33 districts in Zambia have also confirmed cholera cases. And so for the Red Cross, as much as we are targeting, particularly our focus has been within Lusaka province, where we feel there is a huge burden in terms of cases of cholera.
Just hold your thought there. We have a caller, Mambo from Kasampa.
Yes, good morning.
Good morning. Talk to us.
Yes, I want to ask the panelists there. I'm just hearing whenever you bring someone to talk about cholera, the prevention, we are not going to do. Now I'm asking, what are...
Yeah, definitely. I think the role of the Red Cross is to support government and government-line ministries, depending with the situation that we are dealing with. In this case, we have been part of structures within the response that have been set up by government. And so also just to mention that we rightly know that we've got a sectorial cholera elimination plan that was developed by the government of Zambia. And within the plan, there are a number of intervention areas that the government has put in place to eliminate cholera by 2030. So our role as Red Cross, of course, is to give guidance and maybe technical guidance with what we observe in terms of the response. So we do more of the advocacy as well as feed into the multi-sectorial cholera elimination plan in terms of the short and long-term plans that are there. Like we talk about universal access to safe drinking water, which we are equally pushing.